Now we're going to cover some of the major veins of the body. Now you need to switch your thinking here. Instead of starting at the heart and working our way out, veins, of course, drain body tissues and work towards the heart. Veins always flow towards the heart. So instead of thinking of veins as branching, you should think of them as merging vessels, and they merge as the blood flows towards the heart. All right, first we're going to look at the veins of the upper body. So let's imagine there's some blood in the head, and that blood will work its way towards the heart. Blood from deep inside the head will be drained by the internal jugulars. So like blood from the brain will be drained by the internal jugulars, whereas blood from the tissues of the scalp, the face, areas outside the skull will be drained by the external jugulars. The external and internal jugulars merge with veins called the subclavian veins. These terms should sound familiar to you because the subclavian name was used for arteries as well. And then the subclavian veins dump into veins called the brachiocephalic veins. Unlike with arteries, where there was only one brachiocephalic, in veins you've got a pair of them. So veins are more symmetrical in this part of the body compared to arteries. And then the two brachiocephalic veins, technically they receive blood not only from the head but also from the arm. That's why they're called the arm-head veins, brachiocephalic. Both of the brachiocephalic veins merge to form the superior vena cava or cava, which, as you know, dumps into the right atrium of the heart. Another important set of veins, of course, to mention, to remind you of, are the pulmonary veins. We can see them peeking out here on the back side of the heart. Technically, there's 4 of them, and they drain the lungs. And here's a posterior view. You can see all 4 of them there. And these veins are unique because unlike most veins of the body, these veins carry oxygenated blood, and these veins dump into the left atrium of the heart, as you have already learned in previous lessons. All right, let's look at the upper limb. So we've got some vessels in the upper limb that drain the superficial tissues. Out here on the lateral side is called the cephalic vein, and here on the medial side is called the basilic vein. And these are considered superficial veins. They're closer to the surface. Sometimes if you look down at your own upper limb, you might be able to see some of these. They're pretty close to the surface. And they drain the superficial tissues of the body, of the upper limb. And then deep in the arm is a vein called the brachial vein. And it's going to drain, of course, deeper tissues of the arm. Ultimately, if you go and follow these vessels up, in the armpit you will find the axillary vein, and you'll note that the cephalic vein drains pretty high, so it actually merges up higher, basically directly into the subclavian. And then I want to point out, although it's not going to be used for tracing problems for an assessment, but this is an important vessel for clinical purposes, I want to point out the median cubital vein. If you look at it carefully, it stretches from the cephalic over to the basilic, so it's kind of like a bridge attaching those 2 superficial muscles, and they come right across this antecubital area, meaning the area in front of your elbow. And you probably have already guessed the clinical importance here. That's one of the most common places to draw blood from.